Good evening, everyone, and thanks for joining this webinar this evening, being hosted by the Canadian Lung Association. We're really pleased to speak to you tonight during a webinar entitled Marketing, Misinformation, and Mental Health, a webinar exploring why teens are vaping and what we can do about it. For those of you who aren't familiar with me, my name is Sarah Butson, and I am the CEO of the Canadian Lung Association. And as someone who has worked the better part of my career in tobacco and vaping control, I'm really pleased tonight to join you as the host and moderator of today's discussion. I'm going to start with a couple of opening context pieces, and then in due course, I will pass the floor to our two fabulous speakers that are here with us this evening. So the Canadian Lung Association, if you are not that familiar, is one of Canada's oldest health charities, and our mission is centered around protecting our lungs. As a charity, I want to begin by acknowledging our funder for tonight's webinar. The webinar is part of our grant that we received from the Government of Ontario's Ministry of Education to revitalize our Lungs Are for Life program. Lungs Are for Life offers a suite of resources and tools for educators to engage in evidence-based conversations and educational activities to talk about vaping and smoking for students in grades 5 through 10. The resources complement the Ontario curriculum and are available for download on our website at lung.ca. Those resources are in both English and French, and there are also a number of resources for communities and for parents, including downloadable toolkits to guide frequently asked questions about conversations that you can have with young people about vaping and smoking. Before we move forward with the webinar, I do also want to acknowledge the land in which our national office resides, which is the unceded traditional territory of the Algonquin Anishinaabe, which encompasses the watershed of the Kitchissippi, or the Big River, which we now commonly refer to as the Ottawa River. The Algonquin Anishinaabe have been there for thousands of years, long before European contact, and will continue to be here well into the future. Knowing that tonight we are joining virtually from many different locations across Ontario and across Canada, we encourage you to reflect on the land where you work and live throughout the year. And indeed, many are joining tonight from across a variety of locations. In fact, almost 700 people registered for tonight's webinar. And I'm raising that really because I think the 700 registrants really reflects the need in this area. And it reflects the true vaping epidemic that we have amongst young people in Ontario and in Canada. We know that Canada has some of the highest youth vaping rates in the world. And so tonight we've brought two leaders in this space to help us understand more about the popularity with these products and just what we can do about it. Before we get into the webinar, I do want to highlight a few elements about the agenda and some of the technological pieces of how you can get engaged this evening. The format will have two presentations. We're going to begin with Dr. Chaiton, who's going to give us a lay of the land with respect to vaping, followed by Dr. Tulloch, who will then zoom in and give us a bit of information with respect to what's happening with young people. After that, we will have a Q&A and a moderated discussion. If you do have questions for the panelists throughout the conversation, please feel free to submit those by hitting the Q&A button at the bottom of your webinar, and we will try to get as many questions answered as we can over the course of this next hour. Tonight's webinar will only be offered in English. However, a recording of the webinar with French subtitles will be available online shortly thereafter. And you can hit the bottom of your screen again to access captions if you would like to be able to follow along visually with what the speakers are saying. And so with that, I am going to pass the floor to our first speaker, Dr. Michael Chaiton. So Dr. Chaiton is Director of Research at the Ontario Tobacco Research Unit, a senior scientist at CAMH's Institute for Mental Health Policy Research, and an associate professor with the Della Lana School of Public Health and the Institute for Medical Sciences at the University of Toronto. He is also co-director of the collaborative specialization on addiction studies, and certainly no stranger to most folks in tobacco control. So with that, Dr. Chaiton, I will pass to you to share your screen.
Thank you, Sarah. I'm going to start my presentation by going back, back to Montreal in the 1980s, were the headquarters of Imperial Tobacco Canada. And in the 1980s, the tobacco executives were concerned about the decline in cigarette sales. People were starting to quit in large numbers because of concerns around the health effects of smoking. And they were looking to do something about it. So the company brought together its marketing team and some of the research scientists to come up and brainstorm some ideas about what they could do to help this decline in cigarette sales. This this project called Project Day envisioned a couple of different ideas about how they were going to address people's health concerns, and including this example draft of a potential ad campaign for a hypothetical product they called Vision. And this vision, if we zoom in here, it was this idea of a technological cigarette where they say we took away the tar, the carbon monoxide, and the smoke, but left all the enjoyment. Now, Vision never existed as a product, but that idea of having a nicotine delivery device that could deliver nicotine without the chemicals associated with the smoke from the cigarette itself was something that appealed to the tobacco industry. So in 2002, the e-cigarette was invented by a pharmacist in China who developed this device, a nicotine delivery device that delivers nicotine without the smoke. It uses a combination of propylene glycol and glycerin mixed with nicotine, and that liquid is then heated and delivered as a vapor, allowing a person to use nicotine without having to burn substances and inhale them into the lungs. And what's true about this tobacco industry dream was that the vast amount of harm from cigarettes is attributed to the smoke and not the nicotine. The nicotine is crucial both for vaping and smoking, but it's not the main source of harm from cigarettes. Nicotine is the chemical that is primarily responsible for addiction, or as the industry would say, the enjoyment of the product. So with this new product, the industry jumped on the bandwagon and started furiously promoting these products and using the techniques they've been that were so successful in increasing the popularity of cigarettes. This ad from Blue echoes the Virginia Slims "You've Come a Long Way, Baby," emphasizing glamour and sophistication. Or this ad echoes another major theme from the tobacco industry, highlighting freedom, independence, and risk-taking. These devices that you can see in these two ads were the first generation of e-cigarettes. They looked like cigarettes. They sort of felt like cigarettes in some ways, but they're a relatively unsophisticated product. The tobacco industry continued to research and develop the e-cigarette devices. And we're now really on to the fifth generation, I would say, of e-cigarettes. These devices are commonly called disposable e-cigarettes, look more like this. These are two ads from the brands that are relatively popular in Canada, Stealth and Vuzgo, which is the Imperial Tobacco product. And these devices they don't no longer look like cigarettes. They're sleeker, they're smaller, they're easier to hide, and they come in a huge variety of different flavors. This stealth product, for instance, the three there are juicy peach ice, strawberry banana, and blood orange ice. And apart from the wide variety of flavors, they also contain a different chemical solution using nicotine salts. Well, nicotine salts really help the delivery of nicotine, making them much more effective in terms of enjoyment and addiction. With that, with that success, we now, for at least from the tobacco industry perspective, we now see a substantial number of Canadians who are using e-cigarettes. Approximately 6% of Canadians, or 1.8 million people, have vaped in the last 30 days. But among youth, they were much more successful in being able to reach them. 14% reported vaping in the last 30 days. And importantly, 69% of that group had never tried tobacco, and given historical trends, would likely never have tried any form of nicotine had e-cigarettes not existed. In the graph here shows the trends of vaping over since 2015. And from the period where e-cigarettes were introduced in Canada, which was about 2002 or 2003, until about 2017 or so, that what we saw is a kind of fragmented market. There were certainly lots of people trying e-cigarettes, but it was more experimentation than regular use. But in 2018, when the Canadian government properly regulated vaping, what that happened was that allowed the proper tobacco industry to step in. And so that means that e-cigarettes with nicotine were now being sold in convenience stores. That we saw an explosion in advertising and billboards promoting vaping products, and the new modern devices were now being sold in stores. We saw then an explosion in use, particularly among youth, with rates rising from regular use up into the 20%, peaking in early 2020. However, uh, it- because of that explosion, governments responded, introducing tighter regulations, starting to crack down on some of that advertising, restricting the levels of nicotine that were allowed in e-cigarette products, and taking billboards and displays mostly out of stores. Along with that, there was, of course, in early 2020, another event, COVID, which I think had a substantial impact on some people's uptake of e-cigarettes. People were not seeing friends, and so the peer effects of sort of sharing e-cigarettes were lessened. There was also the EVALI issue that came out at that time. And EVALI is an acute respiratory condition that sent thousands of people to hospital in late 2019. It turned out that was not actually caused by e-cigarettes. It was a chemical that was added to a number of THC vapes. But it still, I think, sparked some fears and started people thinking about the potential harms of e-cigarettes. Now, what we see is stabilization in rates of vaping at a higher level. And the big difference to what we saw in the pre-2017 era was that instead of most youth just experimenting and then stopping vaping, a greater proportion of them are using them regularly. So that we'd expect that most people who have tried an e-cigarette to begin using on a regular basis. The question, though, and the hope from the tobacco industry was that e-cigarettes were safe, or at least safer than cigarettes. Now, safer than cigarettes is a pretty low bar. They're one of the most harmful consumer products out there, and pretty much everything is safer than a cigarette. But are e-cigarettes harmful on their own? To answer this question, Health Canada asked the Intrepid Lab, led by Dr. Peter Selby at CAMH, along with the Ontario Tobacco Unit, to conduct a major review of the e-cigarette harm literature. This project, called Vaping and Electronic Cigarette Toxicity Overview and Recommendations, or Project Vector, ended up reviewing 732 papers on some of the health effects, focusing on brain health, respiratory effects, cardiovascular effects, and cancer. In the next part of this presentation, we'll go through some of the findings and recommendations. Vector ended up with an international expert panel that provided specific advice and made findings on the strength of the level of the evidence. The first health effect we'll talk about is those associated with the brain. And the panel found that indeed e-cigarettes were associated with the development of dependence, and that there was an association of poor mental health compared to those who never used e-cigarettes. And this is one of the myths of vaping, that even some in tobacco control will say that vaping is not addictive. That, I think, reflects the period of time prior to 2015, where vaping was generally used as experimentation, and there were very few regular users. The more modern devices and this era of greater marketing and availability have led to different changes where that level of addiction is very clear. We conducted a study of over 3,000 youth from Canada, and of those who vape daily, 86% said that they were addicted, or at least somewhat addicted, to e-cigarettes, echoing that the lived experience of people who use vapes is that they are addictive, and that 32% reported wanting to quit, but were unable to. One of the key reasons that people do vape is that they report vaping to relieve stress. And this is a complicated issue. One of the reasons that it's complicated is that, in fact, there is evidence that nicotine as a drug administered on a unique occasion can, in fact, act somewhat as an antidepressant. That is, that when you use nicotine, you may, in fact, feel better. But most people don't take a single dose of nicotine. As they vape more and longer, they become addicted to the product. And as that addiction develops, you also see the development of withdrawal symptoms and cravings, the types of symptoms that make you feel uncomfortable and bad, and produce a stress on your system. And after so for those, when you're feeling those, and then you take another puff on the vape, and those symptoms of withdrawal and go away, you feel relief, and making it appear that using that vape has solved some of your issues of stress, when in reality, it is that withdrawal and the greater and ever increasing level of dependence that may be having a toll on mental health. And indeed, that's what we found in our cohort study of youth use, that vaping dependence was associated with changes in depressive symptoms. That is, as people became more addicted to e-cigarettes, their levels of depression symptoms increased. They started to feel worse. Now, importantly, there was no bidirectional relationship. That is, that people who were vaped, that people who were depressed and started vaping saw no relief, at least on a long-term basis. We can see this from other data too. This is some from the back-end data of one of our apps we developed to help people quit vaping, called the Stop Vaping Challenge, which measures both mood and cravings over time. And we can see in this example individual that as after the person quit, it was a decrease in their mood as cravings developed. But as those cravings resolved and they started to feel better, their mood improved too. And they ended up, after 20 or so days, actually feeling better than they had prior to having used while they were vaping. Vaping is also associated with a number of different aspects of mental health. Depression and anxiety was found in a review by Becker among 40 studies to have an association with poor mental health. Havad looked at vaping and suicidality, seeing a small relationship. And that a study we just conducted at OTRU found a relationship between use of vapes and poor sleep. The second health effect the panel looked at was respiratory health. And from the Lung Society perspective, this is also one of the strongest levels of evidence that we have so far for e-cigarettes. And the panel found there is strong evidence that e-cigarettes were indeed associated with poor respiratory health, showing an increased risk of respiratory symptoms, such as mouth and throat irritation, cough, asthma, and COPD complications. Again, our cohort studied echoed these findings. So this graph shows the relationship between the number of respiratory symptoms, things like coughs and regular colds and wheezing, reported by people by smoking and vaping status. So this first bar shows an important finding that that smoking is bad for your health, and that those who smoke had more respiratory symptoms than those who never did and didn't vape. But this finding suggests that as people increase their amount that they use e-cigarettes in a month, that they showed more and more symptoms of poor respiratory health. And in fact, among heavy users, that level of symptoms was consistent with that seen among daily smokers and people of that same age. Importantly, though, when people quit vaping, their symptoms improved. The third health effect that they looked at was cardiovascular effects. And here, the panel found that there was strong evidence that acute exposure to nicotine increased heart rate, blood pressure compared to non-users. This is unsurprisingly considered that we've understood this about the effects of nicotine as a drug in itself for many decades. There were, however, some questions about cardiovascular health. There was no link, for instance, with cardiovascular disease in general, but just evidence that we'd expect that relationship to emerge over time with future research. There is emerging evidence on a number of different health issues, and we conducted a review of the reviews that are already out in the literature, where there has at least been some evidence associating e-cigarettes with a variety of different health conditions. Apart from the ones we've talked about, also oral and dental health, maternal, fetal, and child health, bone health, and weight gain. It's important to note here that the long-term health effects health risks of e-cigarettes are yet unknown. It may take many decades for us to fully understand the relationship between e-cigarettes and health, just as it took us about 50 years, and maybe we're not even done understanding the relationship of cigarettes and the health effects of cigarettes. The study and the panel also found that there is no currently known association with cancer, that studies that have been done in that area are just show no effects. But there is a known exposure to toxins and cancer-causing chemicals, and future studies may find a different relationship. I'd encourage people to go see the results of this project at Project Vector at the Intrepid Lab. Here also, it's important to note that there are also recommendations for people who smoke. And what was clear from our review was that the level of health risks from vaping was substantially lower than that from cigarettes. That people who switched from cigarettes to vaping products showed an improvement on many of these health effects. But there was a very clear recommendation for people who did not smoke. that people who don't smoke, and of course, including youth, should not use e-cigarettes. So what can we do from a policy perspective? Well, as we've seen, there have been some policies that have been implemented in Canada already. And those policies, I think, have had a substantial impact. But there are more things that we can do, and there are things that we can do in Ontario that have been done in other places across Canada. Things like a manufacturer fee or licensing that registers and makes the industry responsible for the sales of its products, raising the age of sale to age 21, which has been done now in PEI, restricting flavors further, as the federal government is it's currently looking to do. And we've done partially in Ontario, where tobacco and menthol only are allowed in convenience stores and gas stations, but all flavors are allowed in specialty stores. I think another really promising avenue is to look at these specialty store sales only. Again, has been done now in PEI, which restricts to stores that only allow adults in, and also with a focus that may help looking to help people who are trying to quit smoking rather than as a recreational device for youth. Other policy options include nicotine regulation of nicotine salts, plain packaging, and restrictions of sales and advertising. So with that, we're looking to Dr. Tulloch to tell us a little bit about what we can do about individuals and from a personal perspective among people who vape.
Thank you so much, Dr. Chaiton. And so we'll pass to Dr. Tulloch, an assistant professor in the Department of Pediatrics at the University of Toronto and a pediatric subspecialist in adolescent medicine. She is currently a staff physician and project investigator at the Hospital for Sick Children in the Division of Adolescent Medicine and a physician with the Intrepid Lab at CAMH. Dr. Tulloch, I will pass the floor to you.
Sorry, just in the interest of time, I'm going to try to zip through these slides so that we can have hopefully an opportunity for a discussion. So as it's been stated, we'd like to also explore why, beyond why youth are vaping, what we can do about this. And just for context, as a pediatrician and also a pediatrician who has expertise and a subspecialization in addiction medicine, I've had the opportunity to actually work with a number of families, youth, even educators in the clinical context over the past almost upwards of a decade now at the Nicotine Dependence Clinic and also at Sick Kids Hospital in the Substance Use Program. So I'm going to speak to this topic with respect to a case, and I've drawn on a number of kind of patient examples, and so hopefully this will resonate with a number of you here today. So this is Josh. Josh is a 15-year-old grade 10 student, and he's been doing well academically. He has a few close friends, and he enjoys playing basketball after school. So generally speaking, he's been doing well. Josh has a history of asthma, and he has no recent emergency room visits, or he hasn't had a requirement to use his inhaler. So he's been well controlled with respect to this diagnosis. His growth and development were noted to be on track during his last routine visit, and you as the parent, not really concerned, other than the fact that you have noticed he's become a little bit more irritable, possibly maybe some typical adolescence. We'll see. As we explore this further, this parent, you as the parent find a vape in Josh's pocket when you're completing laundry. So you're trying to figure out what to do next, and you're thinking about how you might approach this. You have no idea, you have no resources and you never really thought about this being a possibility for your son. So as you're thinking about it, Josh enters the room, or Josh enters the house, and you immediately ask, why are you vaping? Probably not the best way to start, but this is where we are at this point. And you start to talk about all of the concerns. So the fact that he might get caught, he might be suspended, problems with his lungs with respect to his diagnosis of asthma, and of course the concern with respect to development and the potential impact on his neurological neurodevelopment. So then Josh doesn't say much at the beginning, but then he says, 1 second, Mom, I'm just going to answer this message from a friend. Oh, and in terms of that thing, I just offered to hold it for my friend Chris. He apologizes, and now you're at a bit of a loss. So as a parent, what would you potentially do next? And what are the signs that might make you a bit more concerned? So I'm going to draw on some of the resources, and hopefully these will be resources that you can then think to go back to and explore the information that are within. So this is not an experiment, an excellent resource from a number of standpoints. So I'll just speak to the point around some of the information that's provided for parents. So you happen to stumble upon this website and you start thinking about some of the signs that you've maybe overlooked. So the irritability, his eyes do appear to be at times a little bit more red and persistently red. He's spending a bit more time in his room. And occasionally you have maybe dismissed that fruity smell when the door's closed. So on this website, there's an excellent a portion of the website that speaks to some of the tips and approaches, and there are some examples as how you might approach at least opening up the dialogue with your young person. So starting off by looking for an opportunity to talk, examples of open-ended questions, the idea of using a non-judgmental approach, remaining curious and engaged, really considering that approach that's more authentic, honest, and transparent. And then in terms of the next steps, working towards the possibility that you might do a bit of role play, potentially, as you might want to support your young person in terms of practicing scenarios where they would be able to at least think about how they might be able to decline the use of or engaging in vaping. So at this point, you're able to use a few of those strategies, and you do get a bit more information from Josh. And he says, well, it's helped me make new friends. So he's now endorsing that he's actually vaping. He then reports that he's feeling a bit calmer, less stressed. And so thinking about all of the data that was previously presented in terms of what we know with respect to this very consistent report of where youth experience, or at least endorse, that vaping alleviates stress. He also reports that it helps with focus. And at this point, he says it's too hard to quit now. So essentially, what's the point? So the key point here is we just like to emphasize the importance of, as any adult who is engaged with youth who might be exploring, experimenting, or they may be using a fair amount of nicotine, vaping or smoking, the main point here is to remain curious, non-judgmental. Try our best to be as honest and authentic, and in doing so, continue to explore their why. So I know that we were able to explore the vaping health related effects. So what I'll do is highlight the ones that I think are most pertinent here, as the Vector project has already been reviewed. In terms of the discussion or the observations that were made, so the parent here observed that Josh's eyes seem to be a bit red and maybe persistently red. And in fact, there is data that supports more evidence that supports ocular effects that are secondary to the exposure to the toxins and chemicals that are within the e-liquid. And so this particular study looks at the lining of the eye in terms of the protective layers. There are some general effects that are secondary to nicotine, and they do also report in this literature review the effects secondary to traumatic injury. So there are a few additional studies, but really here the take-home point is that really to trust the observation, and that in fact we are acquiring more and more data to substantiate these signs and symptoms that we are seeing as clinicians, as parents, as adults that are engaged with youth. In terms of the neurocognitive effects, really here just highlighting that there are short-term and longer-term effects that we know are critical with respect to the concern of the development of the adolescent development in terms of neurodevelopment over the course and into the mid-20s. And so what we know is that there's associations with significantly low scores in higher order cognitive functions. We know that early initiation of use is associated with lower areas in the prefrontal cortex, and the prefrontal cortex is the critical area with respect to executive functions. And so when we had that report from Josh, where he was expressing the concern with respect to focus, this is where we really would need to start having a conversation about what might potentially be underlying in terms of maybe a pre-morbid or a condition that predates the start or the initiation of vaping. In terms of longer term effects, impairment of working memory, impaired capacity to maintain attention, poor impulse control, and really key to all of this, we know that there's an increased risk factor. This is an increased risk factor to concurrent mental health disorders. So the idea that there might, and most likely is, a mental health condition disorder that is occurring alongside the nicotine use. In addition to this, I think it's important to note, because we are acquiring more and more information, more data specific to the clinical presentation of first episode seizures. And there is evidence that supports the association of e-cigarette use with seizures secondary to either immediate inhalation toxicity. And this is important, particularly for those in the clinical space, as we might miss this opportunity in terms of acquiring more of the history that might lead us to understand that this may be part of the picture. And I know that this has been discussed in terms of respiratory symptoms. Sorry, I am in the hospital. Sorry about that. 4 bite, all clear. 4 bite, all clear. 4 bite, all clear. Apologies. And in terms of vaping-related injuries, I'll just quickly touch on that. This study, as it was a study that analyzed characteristics, injury patterns, treatment modalities, looking at severe burn injuries secondary to vaping, localized to the hands, face, and groin and hip, and really looking at the increase in frequency and severity. So this is, I think, critical. I'm actually adding this to the health-related concerns. We think about financial health. Josh reports that he's purchasing his device 1 to 2 times per week. He then reports to us that his device is about $20. And if he's acquiring this 1 to 2 times per week, or 1 to 2 devices per week, then it's upwards of $40 per week. And so when we talk to him and we actually do the math, we could see that he's spending over $2,000 over a year. This could be really important information. And so from a clinical perspective, certainly something that we incorporate in our discussion with young people, but certainly as parents, educators, that this would be a really probably nice opportunity in terms of looking at how you might engage a young person in a discussion about the impact on their well-being. So the second point being that the impact of vaping on physiological health is an ongoing concern in overall health. And it's really important to continue to explore this information, ideally along with the young person, as you continue to work on engaging them in the dialogue around their use. So moving forward, so at this point, it appears that Josh may be interested at least exploring this further with his healthcare provider. So now you as the healthcare provider, you have a concerned parent and maybe a somewhat ambivalent young person who is now presenting in your clinic space. So asking the question and really going back to those principles that we've already explored, but getting back to that question about why. And we have the answers that he's provided, exploring further the concerns related to stress, as this might be an underlying diagnosis of anxiety, exploring further the concerns related to focus, as it may be an underlying diagnosis or comorbid or a diagnosis that is alongside the use of nicotine, such as inattentiveness with respect to ADHD, attention deficit hyperactivity disorder. And then definitively looking at where he is in terms of his motivation, as he's stating that it really has been too hard for him to quit. So exploring that further with him as well. Just wanted to highlight, this is the Ontario data, very our recent data, 2024, but it is the student drug use survey that has been administered every other year. And this has been administered to students in publicly funded high schools since 1977 through the Center for Addiction and Mental Health. And why I just wanted to highlight this, this data is that so when we looked at the past year, among those who vaped, majority of 87% reported vaping nicotine. 43% of students who vaped in the past year stated that they started to vape before grade 9. So just really wanted to emphasize that we really need to think about the initiation that's earlier in terms of those in elementary school. And those students who endorsed tobacco cigarettes, as well as those who were vaping, they report commonly that the source is friends. And so again, just thinking about how we might engage in a dialogue with respect to what the social context is like for the young person, in this case, for Josh. In terms of being able to stop or reduce, when we think about stopping, we use the term cessation. This study from 2021 reported that youth who used daily did endorse that there were challenges in terms of reducing or stopping their use. But roughly 44% of the adolescents who were aged 12 to 17 reported an interest in vaping cessation. So again, although there might be a report of the concern around the difficulty and the challenge, it's important to recognize that oftentimes a young person is actually, they would like to know more information in order to be able to potentially explore how they might be able to reduce or stop their use. So what's getting in the way? So for Josh, he's reporting now that he actually recognizes that anxiety might be getting in the way, and that the anxiety seems to be, at least from his perspective, alleviated with vaping. So again, an opportunity to provide some additional education if he's open to that. And then he also reports that it's easy to access this. So he has friends that he can access the device from, and a cousin who's now been able to offer or purchase the vaping device. So again, more information, exploring this information with Josh, you're able to now kind of maybe move forward with potentially some strategies. And I'll quickly just touch on the point around motivation. So clinically, we would ask questions about readiness, and we would use tools such as a readiness ruler, just in terms of being able to ascertain the importance, the knowledge that they have around the approach to reducing or stopping their use, how confident, how comfortable they might be in terms of that approach. And then we have assessment tools that allow us to be able to acquire additional information that delineates whether this use is problematic, and further to that, whether the use is at the extent or the severity that there is in fact a substance use disorder. So because of and in the interest of time, I will just simply leave it at this is the approach in terms of the assessment, but happy to answer any questions moving forward. And then advise. So really, what do we do next? We start to talk about treatment approaches, which is really a combination of behavioral strategies. And there might be the indication for pharmacotherapy, so medications that might be able to support a young person in terms of reducing their use. And this is the resource from CAMH. In terms of prescribing, so again, I can't really get into the details here, but the main point here being that if we are offering medications, we really need to be thinking about how we are going to titrate, so adjust the medication to the effect, mainly because at this point, it's really challenging to think about the conversion. We have ways of thinking about the conversion in terms of the amount of nicotine, but for the most part, even when we do try to make that conversion happen, or we do the conversion on our own clinically, we do need to think about the patient who's in front of us, the young person who's in front of us, who may in fact report a certain amount of nicotine, but at the end of the day, they may not actually be using that amount of nicotine that they're reporting. So this is a summary of the approach. And the idea here is that we should do our utmost to provide a comprehensive, tailored treatment approach, and that we should really be at the in terms of the most critical aspect of the care that we provide, be considering where there may be concurrent mental health concerns that may have been previously diagnosed, maybe suboptimally treated. So we're not actually able to treat to the point where the young person isn't experiencing symptoms, or they may have been potentially symptomatic and we do not have an actual diagnosis. So the idea is to ensure that we've explored this thoroughly. But of course, we won't be able to get into the details as to how we might do this, but even as a parent and educators, just thinking about those underlying or diagnoses or conditions that might be alongside the young person's use. And when I say might, majority of the young people that that we see and the evidence supports that it's more likely than not that there will be a concurrent mental health condition. So what can we do about this? I've already pointed to some of the resources. So not an experiment, the website here is an excellent resource. Parent educators, additional tools and resources and information that can be found here. Quash through the Lung Health Foundation. There's, again, a number of tools that they've provided, one in particular specific to conversation starters. And so there's a toolkit. And again, I know I'm kind of rushing, but I want to make sure that we cover all of this so we can have further discussion. We've talked about the non-pharmacological approaches. The first line, just to emphasize the point that it is psychotherapy, behavioral interventions, and then, if needed, medication. And then, just to summarize all of this in terms of a treatment approach, ensure that we're asking, we're advising, and we're offering help. And along the way that we're engaging in ensuring that we're acquiring consent to do so. So as a healthcare provider in terms of offering treatment, I'm just going to make a plug for the Nicotine Dependence Clinic in terms of the work that's being done within the Intrepid Lab, in terms of vaping cessation for youth and the substance use program at sick kids. There are other clinical spaces that are providing treatment options, but again, in the interest of time, I'll emphasize those two. And then lastly, just the take-home point. So remain curious, non-judgmental, honest, explore the young person's why. Think about the impact of vaping in terms of the overall health concerns and ongoing concerns in terms of the importance of exploring that information with the young person and being informed as the adult and caregiver who may be involved with the young person's life. And then overall, for everyone to continue to ask questions, advise, and seek out opportunities to offer help. And I'll stop there.
Thank you so much to Drs. Tulloch and Chaiton for those fascinating presentations. Even being in the field for this long, we learn something new with every presentation, so really valuable. I want to get to some of the Q&A that we have as part of the webinar. And Dr. Tulloch, maybe I'll pass to you first. I'm going to call on this one example where someone is actually saying they're not sure if their child is vaping. They're suspicious that they might be. They know that some of their friends are. They've found some missing money. Advice, what can they do in this situation to find out?
So I really go back to the first part of the presentation that sounds like Josh. And a common presentation, I'd say, when I do speak with parents, caregivers. And it does take a little bit of that time to take a step back and take a bit of a pause before we engage. I think it's really common for any parent in a protective way to want to kind of jump in and really intervene. But I think, again, I would really emphasize that we would like to hold that space for the young person to continue to engage in dialogue with you as the parent. We know that the evidence supports that young people do look to their parents and caregivers in terms of being able to be the trusted individual for advice and to be the resource. So acquiring as much information as if possible. We've given you a couple of resources, and then working a little bit more towards the idea of a bit more of a dialogue. And then if possible, if they're interested and they offer consent, who could you then think about referring or bringing that young person to? It might be their trusted family doctor, pediatrician. It might be a counselor that they're working with. It might be a teacher, but look for that next trusted individual, one that you trust as well, that is informed in order to maybe kind of shift to that next step in terms of intervention.
Wonderful. Dr. Chaiton, another individual is noting, we have a minimum age for vaping, yet it seems to be everywhere. Youth seem to have tremendous access. It was noted in the presentations that social sources are a big factor there, but people wondering about whether it's easy to access in stores as well, and wondering about the need for stricter rules or stricter penalties. What's your thoughts from that perspective?
I think that's a really important observation. We only really saw the epidemic of teen vaping and regular vaping use among youth with the introduction of vaping products to convenience stores, in particular, the nicotine products in particular. And that availability of vaping, it really allows people to access them. It only takes a few stores that do sell to be able to provide the products. And of course, there's internet sales as well that allow products to be delivered directly to the door, and often without proof of ID or any other recognition. So I think there are some very clear things that we can do. I think in general, the idea of selling drugs at convenience stores and gas stations is not a great idea. That stores, the specialty stores that provide e-cigarettes to adults who are looking to quit, it has been a relatively effective way of, they're not as appealing to youth as just the gas station effect. We actually see that in Ontario's laws that restrict flavors to those stores have been about as effective as provinces that have banned all flavors entirely. And that suggests that having that access is really the crucial component. And again, it only takes a few stores, and we could start both reducing the incentives to retailers that tobacco companies pay them to sell their products. Again, another easy and sort of a no-brainer in terms of they shouldn't be incentivized to sell, and particularly to youth.
Thanks, Dr. Chaiton. This one I'll throw out to both of you. There's an interesting sort of case question here, because one of the questions I had as I'm hearing both the sort of the high level population issues and the individual complexities of this, the individual students, but then also thinking about the challenges that are happening for the schools as a whole. How do you balance that individual needs versus the needs of the broader school population? One attendee is noting that at a local high school, they instituted a ban on cell phone use. They seem to see a decrease in vaping at the same time, wondering about a relationship there between vaping and cell phone use. Are there other strategies like that that you think might be valuable at a school level? And I'll pass that to either Dr. Tulloch or Chaiton.
I could start, but I really think this is definitely your space. Your space, Michael. I would just say, I think anecdotally, in terms of from a patient perspective, when there is vigilance in terms of the young person's understanding that someone is watching, i.e., someone is caring about what's happening, we do see that that's a form of behavior shaping. So it wouldn't really surprise me to hear that if there is essentially a noticeable decline, whether it be observation in this case in terms of the restrictions with respect to cell phone use, because I would see that would likely mean that there is more eyes on in the classroom setting, so to speak, or across or within the school setting. So that would be my initial thought. But in terms of the data, I have to say that I'm not certain, and I really would look to my colleagues for that.
Mm-hmm. Dr. Chaiton, anything to add?
There is some data that association between vaping and social media use. It's not quite the same question, I think, but that in general, when the vaping at schools and vaping generally is a symptom of sort of the factors that lead people to vape. And also, as vaping is more available and more popular, being connected to people means that you're more likely to have opportunities to connect with people who vape as well. And so I think, from a public health perspective, we should see that as a symptom of the problem. I think, schools are dealing with it. It's disruptive, but it's also, I think, that should take care to again treat people non-judgmentally. That this is, it's not the public health issue is not going to be solved by schools. It's going to be addressed through sort of larger regulations, through and getting vaping products out of convenience stores and reducing advertising and so on.
Okay, great. Really quickly, there's a question here around what do you do with perceptions, perhaps from parents, that vaping is a safer option? And so, where you might actually have parents providing vapes to children because they think it's safer than them getting it on their own. Any advice, or have either one of you seen that occurring? Dr. Tulloch, I'm seeing you nodding. Anything to add there?
This is unfortunately something that we're seeing as a bit of a trend. And I think on one hand, I could see, and I think we can appreciate the effort potentially on the part of the parent to consider this as potentially a harm reduction approach. I think anecdotally, we are aware that this isn't effective, and that it actually provides the messaging that it's permissive. So what I recommend and what we would do in clinical settings is to offer support to parents. So education, providing them with opportunities to acquire more information. And I do think over time, and I have seen that with that information, it's usually there's a bit of an aha moment. And then it becomes, okay, so there's a little bit of having to kind of backpedal a bit, but then, we can see that there's a bit of a shift in terms of the approach. So that's where I would land with that, is really, there is an opportunity to work with parents, caregivers who are in that dilemma. And again, not from a non-judgmental approach, of course. So that's what I would probably add to that in terms of an answer here.
Wonderful. We're at the top of the hour. Dr. Chaiton, any sort of last comments before we close out?
Yeah, I think it's part of the nuance of e-cigarettes. And the recommendation is that people who don't smoke shouldn't use e-cigarettes. But we should also be careful about pushing people into other substance use in sort of fear of e-cigarettes, or particularly from dissuading people who are smoking and have switched to vaping, which is a health benefit. And so understanding that nuance is difficult, but and and there have been a couple of questions here about vaping THC as well, and and I think that's a whole other can of worms that comes in. But there are some similarities, particularly in terms of some of the sort of respiratory health effects, I'd say. But it's a really interesting and complex problem, and that we're all looking together to try and reduce the impacts of.
Wonderful. Well, I really want to say a big thank you to Drs. Tulloch and Dr. Chaiton. This has been a very insightful conversation. I've been watching in the chat, and I think we could do the Q&A for a long time. We could have 2 hours. So a big thank you. For those of you who didn't get your questions answered, we will take note of all of these. We'll try to address them over socials. If you don't follow us on social, please do, and visit our website at www.lung.ca, where we will have the webinars posted as a recording. Additionally, we will be following up via email with some evaluation, and so we really encourage you to fill that out and to follow us to see more webinars like this. And lastly, again, a thank you to our funders. Again, this would not be possible without our ministry funding with our grant for Lungs Are for Life. And a reminder that you can visit Lungs Are for Life for more of those resources to help those non-judgmental conversations and for educators around those in-class resources. So with that, we hope you have a wonderful Thursday evening and stay in touch, and big thank you. Take care, everyone.